of what it's going to take to create a resume, make an application, actually sending it in, getting the call, going in for the interview, and getting the job. How does that sound, you guys?
Great.
If you haven't put your phones on vibrate, now's a good time to do that. Because in the middle of a business meeting, the last thing you want to do is to be the one ringy-dingy, right? So get yourselves off to vibrate.
Thank you.
When I first met Jackie, it was at a professional meeting of healthcare HR and recruiters. And she and I got to talk, and she's from 678. Atlanta, you guys, she's from Georgia. And she brings with her a wealth of information just about being an HR recruiter professional for the last
30 years.
For the last 10 years plus, 10 plus years. Isn't that how we put it on resumes, you guys? 15 plus years.
Some of our dynamics of jobs is front desk, administrative assistant, medical assistant, dental assistant, providers. We got a whole walk of things that we're doing. Even IT, we're doing IT as well.
So how many of you have heard of HealthPoint? Great.
Ooh,
oh,
yay.
good. Now, do you understand what a community health, what's a CHC? Community
Health Center.
Center, thank you. Do you guys understand what that means? That means that they'll serve anybody.
Right.
Right? There's a lot of organizations in town who don't have that compassion of the heart, who don't have that mission. So when you're looking at places like HealthPoint, it's mission-based.
Absolutely.
What's really important is you need to look in your heart as to what's important to you. What kind of people do you want to help? Because if they're the kind of people that Jackie has, and that are Jackie's patients, and I can't even imagine how many members you have.
Last count, we don't call them members, we call them patients, actually. Last count was over 400,000 patients.
So if you wanted to help just one of those 400,000, you would want to talk to Jackie.
Absolutely.
Now, what's really unique about Jackie and what I absolutely love is she has experience here in Seattle, but she has experience from other parts of the country. So she's able to synthesize that and help us when it comes to things like, what should our application look like? What do we need to know when we're looking at her website? So Jackie, I know you mentioned a couple of the positions that are kind of always open. Mm-hmm. What are the titles or the names that HealthPoint uses that maybe our audience wouldn't be familiar with?
We do a medical front desk, medical front office or desk. We do medical assistants. We do dental assistants. We do providers, far as providers or nurse practitioners. We do application trainers, medical assistant trainers, medical office trainers, medical office supervisors or coordinators, referral coordinators, referral coordinator leads.
Okay, so there's there's a vast amount.
Mm-hmm.
Now, are all of your positions union based or are they all market?
Absolutely, no union, only market.
Okay. Different medical organizations, have unionized labor forces. They don't, so that makes them a little different, a little bit of different flexibility.
Absolutely,
maybe. Okay.
Absolutely.
So we're always looking for like mission-driven people, so people who are in the healthcare field because they really want to help other people, not because it's like one of the top fields to be in right now. It's either healthcare or IT. We want people that really are in it for those core values, and so we're always looking for someone who has a value of sense of community, cultural sensitivity, social justice, because that's pretty much how community health was developed, was through social justice with the idea that everybody deserves health care. And so that's our goal as an organization. And so we're always looking for people who believe that same thing, that believe that everybody deserves health care, that believes in community, that believes in cultural sensitivity. And so that's pretty much what our organization's about. We provide what we call a integrated model. So essentially you can get dental services, primary care services, mental health services, social work, and wraparound services all under the same roof.
And you have some clinics in the schools too, don't you?
Yes, so we do have a school-based program where we're in about 14 schools now, and so specifically in the Seattle School District, and that's middle schools, elementary schools, as well as high schools. And basically it's a full setup clinic, so students can go and get full dental care, they can go get full mental health services, they can get primary care, which helps a lot because parents aren't having to take out of school. Are having to take off take off work to go for their kids to go to the doctor. Also, it's really an idea of health awareness and teaching the youth while they're young to be in control and advocate for their own health care. Because some people, a lot of the patients that we see, the only time they go to health care is if they go to the emergency room. And so it's about that kind of patient education, preventative care, and helping youth get access to care that they probably otherwise wouldn't get access to. Then another big part of our organization is our homeless program. And so we have clinics that are set up in various housing facilities and shelters in the city, as well as what we call like outreach team that actually are going out to the streets and basically trying to regain that trust with the homeless population, because some of them don't trust doctors and they feel like they're going to be judged. And so we just kind of want to start that idea of meeting them where they're at and just kind of getting them exposed to other resources for care, with the idea that eventually they'll come and access health care.